Hi, this is Frank with a Frank Opinion. Today I'm doing my 22nd and final video on Medicare for All. And I titled it Medicare for All, A Sad History. Sad because today we have a presumptive Democratic nominee for president who does not endorse Medicare for All. Remarkably, the National Nurses United has endorsed this nominee, Joe Biden. And at the same time, United Healthcare, the poster child for profit-making insurance companies, has posted its best ever profitable quarter in its history. So how did we get here? In 2003, Representative John Conyers from Michigan introduces H.R. 676, the Expanded and Improved Medicare for All Act. Everybody said, including myself, remarkably well written, clear, covers all the bases, terrific bill. And he introduced it with 25 co-sponsors. Between 2004 and 2017, Conyers introduced H.R. 676 annually, reaching 120 co-sponsors with a lot of work from a lot of people in 2017. In 2017, Bernie Sanders introduces S. 1804, the Medicare for All Act of 2017, with 16 co-sponsors. Note, between 2003, when Conyers first introduced 676, and 2017, there was no companion Senate bill to H.R. 676 in the Senate. In 2018, a lot more work, H.R. 676 reaches 124 co-sponsors. In 2019, after John Conyers passes away, Representative Pramila Jayapal introduces H.R. 1384, the Medicare for All Act of 2019, with 106 co-sponsors. Now remember, the year before, H.R. 676 had 124 co-sponsors. This is introduced with 18 co-sponsors less than H.R. 676. H.R. 1384 right now has 118 co-sponsors, still less than the high watermark of H.R. 676. Last year, Bernie Sanders introduced, for some reason he rewrote the bill, S. 1129 with 14 co-sponsors, 2 less than his former bill 1804. So his new bill loses 2 co-sponsors in the Senate. In 2019, we have 3 House committee hearings that fail to make the case for Medicare for All. I would submit to you that they were set up for failure. Amongst other things, the primary economist providing testimony for the Democrats is Dean Baker, the co-director and founder of the Center for Economic Research and Policy in Washington. A disaster. I'm watching this and I could not believe that this individual decided to play a role as a prime testimony at the Rules Committee, the first one, with so little knowledge of the bills and of the research that had been done. I give him an F-, and that's being generous. Virginia Congressman Bobby Scott was the only representative in 11 and a half hours of committee hearings, all 3, Budget, Rules, Ways and Means, that did his homework. I give him an A. He's the only one that refuted the constantly told lie in these hearings that Medicare for All would cost $32 trillion more over a 10-year period than what we're currently paying now. That was a lie. It was purposeful. But since our committee members, the Democrats, didn't do their homework, and because the panelists were chosen by the Democratic elite, the Pelosi, Denny Stoyer, Jim Clyburn, I doubt that Pramila Jayapal had much of an input there. That lie was continued for 11 and a half hours. Over the last number of years, let's say starting in 2015, I just put down here some of the discarded people along the way. Dr. Gerald Friedman, who from 2015 to the present has done major studies, an initial one in 2015 and 2 revisions in 18 and 19. Robert Pollin, the organizer at the Perry Institute, Political Economy Research Institute, who did the analysis on the Senate bill, Bernie Sanders' bill. Gerald Friedman was doing the analysis on the House bill. Richard Master, the chairman of the board and CEO of MCS Industry, who with his own money and his caring developed the Fix It healthcare campaign that is still there on the phenomenal website with wonderful videos on our broken healthcare system, our corrupt healthcare system. We discarded 22 studies all saying the same conclusion since 1990, and that is along with the 5 most recent studies, plus the Lancet Yale study and the Jerry Friedman studies and the Perry studies, that say single-payer Medicare for all is the way to go from a financial, a medical, and an ethical standpoint. And we discarded or not used sufficiently well a monumental Medicare for all hero, Addie Barkan. What were some of the blunders over the last number of years? No Senate companion bill to H.R. 676, introduced in 2003 until 2017. This includes the time that Bernie Sanders has been in the Senate, because he was in the Senate, has been in the Senate since 2007. So 10 of those years, he did not introduce a bill. Rewriting H.R. 1384, losing sponsors, losing time. Everyone kind of said that H.R. 676 was the gold standard. Why not just write it word for word on the Senate side? When you have something so difficult to achieve as Medicare for all, why make it more difficult and rewrite a bill? Bernie Sanders rewriting 1084 to 1129, discarding the Medicare for all champions, some of which I included on the previous page, not employing representatives from countries with universal health care coverage, France, Japan, Canada, Northwestern European countries, 38 countries with universal health care, and we don't bring their experts, their citizens, for an ongoing campaign from coast to coast, Midwest, South, everywhere in the United States, to tell U.S. citizens how wonderful their situation is. Not clearly and forthrightly answering the how to pay for it question. Easy. Bernie Sanders' own options for funding Medicare, his first 2, as I've indicated in previous videos, the 4% employee tax saves 90% of Americans money. And those that are on the modest, moderate, middle income, a huge amount of money. It saves states money. It saves businesses money in terms of the 7.5 business and payroll tax. Not forcing a meeting with Joe Biden. Biggie. A few months ago, Joe Biden was craving support from the progressive sector. He wasn't the shoo-in that he is now, supposedly, as Trump does what he does. So, what is the sad result of all this? We have a Democratic nominee who's opposed for Medicare for all. We have a situation where the most prominent union worker organization, National Nurses United, has somehow seen fit to endorse him without having a meeting. We have a fragmented and weak Medicare for all movement. These are not my words. This is from an email from a prominent Medicare for All leader whose name I will not reveal. And United Healthcare posts during a pandemic the most quarterly profits in its history. That's our history. And I think it's sad.